So now we are going to talk about antibiotic classification. Firstly, we will talk about the major classification, then the adverse side effects as well as mechanism of action. Firstly, it's the beta-lactam, that is penicillin and cephalosporins. They stop the peptidoglycan cell wall synthesis by binding to protein binding sites and cause the cell lysis. Their adverse side effects are anaphylactic shock, rashes, allergies, and interstitial nephritis. Secondly, it's vancomycin. Its mechanism of action is they bind to the terminal of peptidoglycan in the cell wall, that is the D-alanine D-alanine. Hence, they stop the cell wall synthesis. Their adverse side effects are ototoxicity, nephrotoxicity, and Redman syndrome, that is the increase in histamine release. And the third is aminoglycosides. They bind to the 30th ribosome and stop its synthesis by proofreading of mRNA, and they are bactericidal in nature. Their adverse side effects are ototoxicity and nephrotoxicity as well as neuromuscular blockade. Okay, so next is macrolide, which is further classified into azithromycin, clarithromycin, and erythromycin. Its mechanism of action is it stops the protein synthesis by binding to 50S ribosome, and the adverse effects are cholestatic hepatitis, QT prolongation, as well as GI upset. Next is tetracycline. The mechanism of action is it stops the protein synthesis by stopping the tRNA binding to 30S ribosomes, and it is bacteriostatic in nature. The adverse effects are photosensitivity as well as teeth discoloration, and it is contraindicated in pregnancy. Fluoroquinolones, its mechanism of action is it stops the bacterial synthesis by binding to DNA gyrase and topoisomerase 4 enzymes, and the adverse effects are QT prolongation, a tendon rupture, as well as cartilage damage. Is a sulfonamides is mechanism of action is they stop the folate synthesis by inhibiting the dihydropteroate synthase enzyme, and their adverse effects are hemolysis in G6PD deficiency and as well as the Steven Johnson syndrome. We are going to talk about analgesics, which are used to reduce the pain of the patient without losing the consciousness. They are classified as NSAIDs, paracetamol, and opioids. NSAIDs examples are aspirin, naproxen, and ibuprofen. Aspirin irreversibly inhibits COX-1 enzyme, while NSAIDs have the function of inhibiting COX-1 and COX-2 both enzymes and reducing prostaglandin synthesis. Hence, they stop the inflammation and pain. The adverse effects of NSAIDs are gastritis and gastric ulcer, as well as the kidney injury in case of the dehydrated and elderly patients. While aspirin adverse effects are bleeding, and they cause rare disease or syndrome in kids, and they also cause the antiplatelet effects. While in case of the paracetamol, it acts centrally by reducing prostaglandin synthesis in brain, and the antidote to paracetamol toxicity is an acetylcysteine. Their adverse effects are dose dependent hepatotoxicity, while opioids work by inhibiting mu receptors in brain, and they stop the pain transmission in brain. They have the examples like fentanyl, morphine, and tramadol. Their adverse effects are constipation, respiratory distress, as well as sedation.